Good morning. This morning, I'm going to give further details around the situation of maternal child health in Kenya. And I apologize, I may end up with a bit of depression, but I'm going to start with the bad news and end up with the good news, because we are making good progress in some places. So this was a headline that occurred in 2010, one of the key newspapers here, that was a wake-up call to many of us that really highlighted the importance of us readdressing the issue of maternal health. So this spurred some immediate action from the leadership of the country. In my presentation, I'm going to give a little more details about the background of the maternal health in Kenya, and also I'm going to throw in the issue of the child health, because it's a key component, and also show some of the progress we are making towards addressing the problem. The speaker after me will give more details around the county level. As a matter of background, we have been in this journey for some time, both at a global level and also at a regional level. And I've just highlighted some of the declarations and commitments we have made to save mothers and children. And I want just to highlight the importance of MDGs as a major aspirational goals we all agreed to follow by 2015 and achieve certain targets across all countries. Also at a regional level, the leadership of African Union did mobilize the leadership of Africa and had the Maputo Protocol that again re-emphasized the important role of leadership in Africa in addressing the issue of maternal health. And lastly, I want to also highlight the issue of CAMA, Campaign for Accelerated Reduction of Maternal Mortality in Africa. It was yet another commitment on the need to do something different from what we've done in the past to save our mothers and children. This is a global picture that's showing where women are dying. The darker the color, it shows what the problem is. And you can largely see maternal deaths is basically a sub-Saharan Africa problem. And you can see Kenya where we are placed. This is the latest MDG progress report, and I wanted to highlight some progress. And you can see the other speaker didn't mention the issue of some countries have done very well in terms of addressing maternal mortality, like Eritrea, our neighbors. And you can see, we can identify where Eritrea is. It has also made some good progress in terms of addressing the issue of maternal health. And we're always good to compare ourselves with our neighbors in terms of what they're doing. So where are we in Kenya? The estimate we have, and it's good to know that it was worse before, and you heard that we are making new momentum to make some progress. So this is a snapshot where we are. So we have over 100,000 deaths of children before their 5th birthday, and over around 6,000 women dying every year from pregnancy and childbirth-related complications. But as I'm going to show, as you have been shown earlier, it was worse. But we have made some progress, but not good enough. But I want to highlight the issue of under 5 mortality. In other words, probably a child dying before their 5th birthday, we are making good, very, very good progress. The issue of maternal mortality, we are making some gains, but we need to work much, much harder to reverse the current trend. And that's why we are basically in this meeting. This graph shows the distribution of the deaths. You heard about Mandera, Turkana, Wajir, Nairobi, Migori, Nakuru, Siaya, Kisumu, Homa Bay, Kakamega. And the professor is going to speak after me, is going to more detail about where these deaths are occurring. It's important to identify these areas, because then we're able to have a strategic approach to the problem. Over 90% of the deaths are occurring in only 15 counties. And therefore, that's where we need to focus our energy. It doesn't mean that we need to ignore the other areas women dying, because even one death is bad enough. That's our rallying call. It's also important to ask ourselves what is really killing when we meet women. And this is just this is an example of a study which was done in Western Kenya, looking at why women die. And these are looking at direct causes. And you can see from the yellow part is postpartum hemorrhage. In other words, bleeding after delivery. These women are dying after delivering death because they are delivering children at home where there's nobody can help them, or where the referral system to the nearest facility may just be too far. So I wanted to focus on this, the yellow part. You can see the biggest part of the pie. Almost 25% of the deaths are associated with bleeding. And therefore, the importance for all of us to do our role to ensure that women deliver under care of a health worker. If you look at indirect causes, this is just one, the county. You can see in western part of the country, HIV is becoming a major cause of indirect cause of death among women. And therefore, the need for us to have a comprehensive approach to issues killing our women. And you can see the other causes. And you can see from there, all of them are basically preventable causes. We can do something about malaria. We can see something about anemia, and including infections when a woman is either pregnant or after delivering. This is important because it then gives us a focus in terms of what will need to be done in terms of intervention. And whether we are looking at direct causes or even indirect causes, all those conditions are largely preventable. All can be managed if the pregnant woman can be able to access a health worker, a trained health worker. It's also important to ask ourselves, when do women die? So the red part, you can see the pie chart, half of our women die immediately after delivery. And therefore show the importance of critical moment when we need to save these lives. It goes again to emphasize the importance of a woman delivering under care of a health worker. If a woman starts bleeding, if the woman has a complication and delivering at home, probably at home there's very little can be done. But if she's in a health facility, that is functional. In other words, a health worker is trained, the equipment, another intervention, the drugs are available, that life can be saved. You can see 25% of the women also die during pregnancy, and that's what shows the importance of women attending antenatal care as well. So this, I just gave an example of what happening in the western part of the country, but we are now going to go further to do further analysis this year, look at what is happening in each county so that we're able to develop appropriate responses. As my predecessor talked here, he said about we need to have appropriate responses per county based on what is clean our women and based on the context that in which we find ourselves in each particular county. In other words, we need to have a very specific county-specific strategy to address the issue of maternal health. While they are dying, I just want to highlight the issue of delays. We delay in making decisions at home. They don't recognize danger signs and therefore need to move to a nearest facility. And even when they're in health facilities, sometimes we just take too long for these women to receive care. And therefore, the whole issue of quality of care, which was emphasized by the speaker who was here before me. Therefore, it's important all of us ensure that women deliver in health facility, but even our health facilities are functional and they provide good quality care. I just want to highlight good news now. So the graph you're showing there, I'm showing there, is showing deliveries in public facility over the last 2 years. And you can see the line graph is going up and up and up. This is per month number of deliveries in public health facilities. This is what we want to see. We want all women to deliver in health facilities. But also you can see some dents. Can you see that? And I've highlighted that. That is when health workers go on strike. That is when health workers are on a go slow. So it is for everybody's interest in this country to ensure that health workers are happy. And I'm happy the chairman of Council of Governors is here, and the governors are here, and our cabinet secretary is here. I wanted to show this because when women hear health workers are on strike, health workers are on go slow, they resist. They don't go to health facilities. They choose to deliver at home. And you can see the moment we are back on duty, women come. They want to deliver under care of a doctor, under care of a health workers. 50 years after independence, that is what is good for a woman in Kenya. That is what is good for this country. And I'm very proud that this campaign of free maternity is doing well, and you'll hear more from our cabinet secretary. This is where we need to go. The financial barriers are being removed, and therefore the choice whether to deliver at home or health facility is not based on whether you have money in your pocket or otherwise. The women are aware now that we have providing free healthcare services. They can deliver for free in health facilities. Do we know what needs to be done? We do. I've just highlighted a few things that need to be done. Quality of care, ensure you have essential medicines. And it's important that all of us are here, both county and national government, because we must ensure that our health facilities have commodities. They have the gloves, the drugs the doctors need to save lives. Issue of safe blood. When there is an emergency that needs transfusion, remember what I was showing, that 25% of the deaths are due to bleeding, that woman may need transfusion. We must ensure our blood transfusion services are functional and the blood is safe. And more important, issue of accountability. Every death must be counted. Every death must be accounted. Every death, we must know what went wrong so that we learn from that mistake and so that it never happen again. That should be the commitment from everybody. I've just highlighted a few things that need to happen, and it's important that all of us know that what is killing our mothers can be prevented, or we know how to manage them. Something that we don't usually talk about, and we're coming over and over to realize, and I want to ask you, can you count the number of babies? This was a single delivery, by the way. Who think there are 10 children? 5? 6? Who think there are 6 children? 7 children? You need opticians, you guys. They're actually 7. There's another baby the other side. What we know, that when a woman is pregnant by choice and not by chance, she's pregnant when she wants to get pregnant, we will be able to save 25% of maternal deaths. You can imagine, as you know, how you can save a quarter of the deaths just by showing that a woman is pregnant when she wants to get pregnant. And therefore, the need to offer people to access family planning services. So we have low-cost interventions that can save thousands of lives. I just wanted to highlight a few things. A little more, we need to invest, and I've just highlighted a few more things that will be a basis for a discussion later. We know what needs to be done, but also we need to do it at a coverage that is really going to make a difference. The issue of sustained investment, both by national and county government, is important. We know the issue of saving women is an issue of human rights. It stimulates economic productivity, and you ought to hear from the World Bank colleague. It is cost-effective. It reduces poverty. We all know the cost of losing a mother in a family. That's the first sign that that family will be poor soon. But I also want to end my presentation by the good news that there's a new momentum, and I want to congratulate Her Excellency for the Beyond Zero campaign. It is a campaign about saving mothers and children. They have showed us you care about women and children of this country. And I'm glad that the spouses of governors are also here with us, and they have taken up this campaign at the county level, because that's where we are going to make a difference. You did tell us many things, but you did many things as well. This is London Marathon, and you can see some of the team members are right here, but the institutes today, you may not recognize them. But I want to recall one of your statements when you said, I have decided to run to raise awareness and mobilize resources to be used for prevention of maternal and child death, because you care. And that is why we are all here. You ran to raise resources. You ran, even more important, to tell us the numbers and figures about how many women and children die in this country. It's now top of mind of journalists and all of us. We all know 100,000 women die, children die. We know over 6,000 mothers are dying, and so on and so on. It's a figure that now resonates with most of us. It's a figure that, those are the figures that make us wake up. I say, yeah, I need to do something about this. You're also gone further, not only to run, but also to distribute mobile clinics that are going to make a difference in terms of access to care. On the lower part, we are seeing you in Kajiado, where you donated the second mobile clinic. And the first one there is where you were in Taita, the first county to benefit. I know we have a long list and the schedule of where else you are going to go, and I know this Friday you'll also be in Homa Bay. Just basically living the commitment they've made that you're out there to save lives of mothers and children. Remember, I started with the bad news, where women are dying in Kenya. I want to end with the good news, the Kenya we want. This is a picture taken in Coast Provincial Hospital, a hospital managed by the county government of Mombasa. It is a facility that is functional. And you can see that baby had just been born a day before Her Excellency visited. This picture was taken during World AIDS Day, on the eve of World AIDS Day last year. And that is what we want. We want a happy ending for every pregnancy. We want a happy ending for every delivery. I want to show this because these are public health facilities. Majority of our women deliver in public health facilities. And therefore, it is our own interest as a country to ensure that our public health facilities are functional and therefore the need for us to invest. I want to end there and by thanking all of you and asking you this question: do you care enough to make a difference? Thank you very much.
Thank you. Thank you very much, Dr. Muraguri. Dr. Muraguri is the Director of Medical Services at the Ministry of Health. Now, if the statistics have not shocked you up to now, do not worry. We have 2 days to go through this. And